She dedicated 30 years of her life to working in long-term care. And on New Year's Eve, Sheila Yakovision passed away from COVID-19.
Wanted to take care of residents. Ashley's the one that couldn't take care of herself.
The 60-year-old worked at a Windsor long-term care home, one of the more than 200 in outbreak across Ontario, which has sparked several protests at homes like Tender Care Living Centre east of Toronto. 60 residents have died from the novel coronavirus, which has prompted an outcry from families and advocates demanding better conditions.
I didn't realize how hard it was to communicate with the government or to get their response.
Long-term care critics say the province isn't doing enough to help a sector that is in dire straits.
That is the result of either a lack of prioritization or a lack of understanding. And it's hard to imagine how it could possibly be a lack of understanding.
Canada's National Seniors Advocacy Organization says there are steps the province can take now to curb the spread of COVID-19 inside long-term care. Steps that include a hiring and mass training blitz in infection control and PPE usage, rapid response teams similar to what New Brunswick has done that are trained in containment and treatment of the virus, implement permanent infection and control experts in homes, make rapid testing available to those who live and work in long-term care, as evidence has shown that it is more than 70% effective and will help to screen out the virus and vaccinate.
There's been really good steps done by BC, Alberta, New Brunswick, Nova Scotia, and Quebec that we could have been learning from.
To make sure that they had these safeguards in place ahead of what we knew and what was well predicted to be a more dangerous second wave.
In a statement to Global News, Ontario's Ministry of Long-Term Care says it is working to address some of the issues raised by advocates in this story, adding that it has invested $1 billion into long-term care resources. Morganne Campbell, Global News, Toronto.